The NSABP B04 trial, radical mastectomy versus total mastectomy. Welcome to the Everything Surgery podcast, where we delve into some of the most transformative studies in medical history. Today, we are exploring the National Surgical Adjuvant Breast and Bowel Project Protocol B04, a landmark clinical trial that fundamentally changed the management of breast cancer surgery. This pivotal trial set out to answer a crucial question. For women diagnosed with operable breast cancer, whether or not they had axillary lymph node involvement, could a less radical operation, specifically a total mastectomy without axillary node dissection, offer survival outcomes equivalent to the traditional radical Halsted mastectomy? Between 1971 and 1974, over 1,000 women with breast cancer participated in this study. These individuals were carefully grouped based on the presence or absence of clinically detectable lymph node involvement. Women without axillary node involvement were assigned to one of three treatment approaches: the radical Halsted mastectomy, total mastectomy combined with radiation therapy to the chest wall and regional lymph nodes, or total mastectomy alone, with axillary dissection reserved only if lymph nodes later became positive. For those with clinically positive axillary nodes, the treatments compared were radical mastectomy and total mastectomy with radiation therapy. The findings, published over several decades and culminating in a 25-year follow-up, were nothing short of revolutionary. The results demonstrated that there was no statistically significant difference in overall survival, disease-free survival, or freedom from distant metastasis between any of the surgical groups, regardless of nodal status. This meant that more extensive surgery did not translate into better outcomes for patients. In women who received total mastectomy alone and were initially node negative, approximately 40% eventually developed axillary node positivity. Importantly, this did not lead to worse survival compared to those who underwent immediate radical surgery or radiation therapy, suggesting that breast cancer is often systemic from the outset. Consequently, removing axillary nodes appeared to serve more for staging and local control, rather than curing metastatic disease. The study also highlighted the role of radiation therapy, which was effective in reducing local and regional recurrence after total mastectomy, but did not enhance overall survival. These insights collectively challenged the long-standing Halstedian belief that cancer spreads in a predictable, stepwise fashion from local to regional sites and then to distant locations, thus questioning the necessity for radical surgical procedures. Perhaps most importantly, the trial paved the way for a paradigm shift toward more conservative surgical strategies. It provided compelling evidence that less mutilating procedures, such as total mastectomy, could be just as effective as radical mastectomy. This set the stage for subsequent trials, including those investigating breast-conserving therapy, and began the move away from routine radical axillary dissection toward less invasive techniques, such as sentinel lymph node biopsy. The trial's support for the systemic theory of breast cancer, sometimes referred to as the Fisher hypothesis, underscored the critical importance of adjuvant systemic therapy, like chemotherapy and hormone therapy, over surgical extent in influencing survival. In summary, the National Surgical Adjuvant Breast and Bowel Project Protocol B04 proved that radical mastectomy was no more effective than total mastectomy in improving survival, sparking a revolution in breast cancer surgery by promoting less invasive and tissue-preserving approaches. This remains one of the most significant clinical studies in the history of oncology. Thank you for joining us. If you find our discussions insightful, please like, share, and subscribe to the Everything Surgery podcast, where we continue to dissect the extraordinary in surgical science and patient care.